I come from a lineage of orthopedic surgeons. My father is an orthopedic surgeon, Jeffrey Mast. He was a pioneer in the field of orthopedics. Did a lot of things. He left some big shoes to fill, so to speak. At the end of the orthopedic training, I felt a calling towards the same stuff my father had done. I wanted to learn more about the things that he had pioneered, in particularly osteotomies around the hip, some of the ways that you can prevent arthritis of the hip by correcting biomechanics. And so biomechanics became very interesting to me in that regard. So I spent time with a variety of surgeons who were specialists in their field of hip surgery. I spent some time with Dr. Joel Matta, who's a pioneer in hip surgery and the treatment of a type of hip fracture called an acetabular fracture. Acetabular fractures are complex injuries, very difficult to treat, require a high degree of technical competency to achieve good results. Really gave me a lot of experience in managing and understanding the hip and the pelvis. After that, I spent a very important time in my career working alongside my father. It was the last chance I had to overlap with him, so I took 9 months and just worked alongside him. I was working at the time also on pushing forward some of these techniques that I had learned from Dr. Matta. Well, during that time where we had this overlap, I used to try to figure out how to best get the outcomes that you want, and part of the outcomes isn't just the technical execution of what you're doing, but it's understanding what the patient wants and what the patient is desiring of you or desiring of the consultation. And in talking to my dad, I remember a few fireside chats, so to speak, where we would he'd tell me kind of his thoughts on it. And one of the things that really impressed me about it was the empathy. It was the idea of trying to put yourself in the shoes of the person that's coming to you and trying to understand for them what is the most important thing, what they're trying to accomplish. And then counseling in the same way you would counsel your own brother, your sister, your mother. Try to see that person as a family member or your closest friend. That's the way to achieve excellent outcomes, is to try to really understand what the patient wants of you. I sit there and I as I'm listening, I'm trying to understand, what is the issue? Is it that they want to get back to horseback riding and it's just being able to sit comfortably in the saddle again? And if that's what it is, then how do I counsel that patient so that we can achieve that? And generally in the least invasive manner that we can. My father was one of the giants of orthopedic surgery. The idea that I will someday fill his size 16 shoes, I don't know, but I'll do my best. That's all I can promise.